think of a nurse, I think of someone who takes care of their patients and goes around helping everyone out and making sure that their facilities are clean. A nurse during their shift takes people's temperatures, gets medicine, just helps people out.
My definition of a nurse is somebody who comes in before the doctor comes in, and they check your temperature and how you feel eventually before the doctor.
When I think of a nurse, I think of someone that's the middleman between a patient and a doctor. And between their shifts, they're just helping prep the patient for when the doctor comes in. So there's someone that's really caring and efficient.
What I think a nurse is the main caregiver of the patient and the communicator between the doctor and the patient, and then they can figure out what the patient really needs and communicate with the doctor.
Had the nurse in charge, and the other two nurses were in and out of there with Aunt Lisa and I every half hour. And when shift change happened, they stayed to make sure that she was still comfortable. And when I say she was experiencing unbelievable pain, it was heart-wrenching to see her in this pain. When they finally administered the medication, she was relieved, which was a godsend for all of us and the nurses also. And again, I say the shift changed and these nurses stayed until Uncle Jay came so that they could relay to him what had happened during the day. It was the most unbelievable, caring experience that I've ever had between someone other than family had with Aunt Lisa. And Aunt Lisa is the good today, I'm convinced, because of the total care that she got from the nursing staff at the hospital. And it was every day, not just this day. How caring, compassionate, and wonderful they are. They hugged me, they hugged her, it was just, I can't tell you what an experience it was. You almost had to be there to realize what these nurses gave that day. They gave their all so that she could be comfortable, and she was.
I think a nurse is the first person that comes in the room and tells you that you're sick and gives you a shot.
Nurses they administer medication and medical procedures, and they are also the eyes and ears of a medical facility because they spend the most one-on-one time with patients.
When I think of a nurse, I think of someone who is kind, compassionate, administers medications, and they do all the hard work before the doctor comes in.
I feel a nurse is your primary caregiver. They're the ones that are always going to be by your side when you're in the hospital. They're the ones that you're going to go to when you need assistance, whether you're feeling good or feeling bad that day. They're the ones that are going to come in and support you in good times and in bad. They're also the ones that are going to support your family. A nurse is a special person. They're the ones that are always going to be your support system. They are your primary caregivers when you're in the hospital. I love all the nurses that I know.
So, briefly, what does a nurse do? I would say the nurse's main job is implementing the doctor's orders. That might be dispensing meds, changing dressings, initiating further testing, monitoring patient response, also noting any significant patient observations during the nurse's interaction with the patient, and communicating with the doctor. During a shift, a nurse might also be required to interact not only with the patient but also with the patient's family, in person and by phone, updating their condition and explaining what's being done and why. A nurse would also be required to empathize, not only with the patient, but also with the patient's family. And maybe that would involve providing some extra services to make the patient's stay more pleasant. I'm sure there are many other things that a nurse has to do. Considering the number of patients that are assigned to the nurses and the severity of the diagnosis for the patient that the nurse may be attending. But I think sometimes they're hard pressed to fulfill everyone's expectations. I believe that nursing is a difficult job, not an easy job. And I believe that it requires a very dedicated person.
A nurse is someone who takes care of a patient when they're sick, but there's also a lot more to the job. I feel like, especially working night shift, I'm able to really get to know these people on a different level. We don't have as many people coming in and out of the room, and a lot of the time we don't have visitors or family members spend the night. So it's a lot of one-on-one interaction with the patients. So we're really able to get to know them more than just the patient in the bed. Nurses also really advocate for their patients because we are with them 24/7. We're providing 24-hour care. So we really are able to see changes in our patients quickly, whether that be positive changes and they're improving and working towards discharge, or whether that be stepping in and performing interventions that are necessary when we start to see a patient deteriorate. I also do feel like one of my favorite parts of the job is when you admit someone and they're really sick, and then you take care of them throughout their admission, and then you get to see them go home and they're doing a lot better. It's a really cool part of the job. There's not always doctors on the floor, so we really are the ones that have to pay attention to changes in vital signs, or sometimes you'll just have a gut feeling that something's different with one of your patients, or that something's going on. So we are really able to step in and provide whatever's necessary to that patient at the time. Something that's also really stuck out to me during my first year of this job is early on in my orientation, I had a conversation with my manager, and she told me that patients come to the hospital for nursing care. And that really stuck out to me because at the time I didn't think that. I hadn't been in the job long enough to really know what all was involved. And it really just does show the importance of nursing care and the 24-hour hands-on care. We really get to know these people, and we are the ones that step in when necessary. So I think overall nurses really do make a difference in people's lives, and we really are important, especially when people are at their most vulnerable.
Hi, my name is Joanna. I'm currently a pediatric ICU nurse at Kentucky Children's Hospital. I've worked there for the past 4 years. That was my first job out of nursing school. So some things about what I do as a nurse: I routinely assess my patients. I'll have 1 to 2 patients since I'm in the ICU. I administer their medications, whether it be IV or oral or through a G-tube or like a nasogastric tube. I also help coordinate care as the person that's at the bedside most with the patient. You really are the person that kind of helps connect the dots between different care teams, and also serve as a patient advocate. And then one of my favorite parts of my job is that I get to routinely provide emotional support for patients, and I really get to know not only my patients but their families, and that's one of the things I love most about my job.